Before we get into how we're going to fix it, let's just understand quickly how these bulging discs work and use the spinal models. First, we've got the healthy disc. In here, we have the nucleus pulposus. This is the fluid in the disc. Then around here, this outer layer, you see lots of different layers of ligament. That's called the annulus fibrosus. And what essentially happens when we have our disc is that load comes through the disc and it causes the fluid to want to escape to the side, because the bone on top and bone on bottom of this vertebra are going to be the hardest points to escape. The fluid can't escape through those. And what it's going to try and do is push out to the side. The ligaments, like all ligaments, are stretchy. They bend, they move a little bit in response to force. So as we compress down in a neutral position equally through the disc, it's going to try and escape in all directions. So now where we have the bulging disc, you can see just here, and what that looks like on the side, just around here, is that it's broken through some of those inner layers. And now, instead of having maybe 10, 12, 13 layers of annulus fibrosus to break through, or restraining that disc in place as we compress down evenly through the disc, we now only have 5, 6, 7 intact layers here. And that means that that compression, the disc is just, or the central part of the disc, the fluid, is just going to try and escape in through the path of least resistance. And if there's only 7 fibers over there, it's going to shoot in that direction. And that's where we get this bulging. Now to quickly contrast this with the herniated disc, that's where it's gone through all of the layers and it's just straight out the back, and we'll get this kind of phenomenon occurring here, where the fluid has leaked out of the actual disc. Now going back to the bulging disc, the same will be true for the herniated disc, but it's essentially going to be bulging out towards the back, and it can either put direct pressure on the nerve, giving us back pain, giving us sciatica, buttock pain, etc. Or it can be that the inflammatory reaction to the understandable tissue damage in this region is going to create congestion in these small spaces, which is going to create pressure, just like if you've ever sprained a wrist or sprained a knee or ankle and it swells up, you can feel there's a bit of pressure in there, but because we've got nice stretchy skin, we can kind of put up with it. In this area, we have the bony confines of the exit foramina or the central spinal canal, and that's where that pressure can build up and start to aggravate some of those nerves and give us the pain we're experiencing. Now, one of the really frustrating phenomenons here is that the disc bulge might not actually be touching the nerve, and so you go and you have your MRI report and they say, oh, the disc is bulging, but it's not actually pressing the nerve. And that can be really confusing because they just send you on your way. Now, when people have these bulging discs, they're often told to be careful, which is understandable in the early stages of recovery. They're told to avoid bending, lifting, and those sorts of activities. But if we never transition to the next step, we're going to constantly be preventing our body from getting the necessary stimulation it needs to strengthen those discs back up again.